Hi, welcome back to Whiteboard Wednesdays. This is Dr. Inkyong Parrack from Sarasota Vascular Specialists. Today, here to talk about prevention and treatment in vascular surgery. There's going to be both medical and surgical components to vascular surgery, and we're going to talk about both. Prevention, what does this mean for you? So I have a lot of friends and family members who, have come up with a very healthy lifestyle. They eat organic foods. They try to stay away from too much red meat. And people have done exercises, walking, and whatever that they're supposed to be. So on the outside, you would never know that they may be brewing some vascular disease or plaque development inside. There's actually, in most instances, no warning about the plaque. How does a heart attack happen? How does a stroke happen? It's a sudden event. So you will never know as you walk day to day if something could happen unless you go checked on it. The second component of preventative care is not just trying to figure out whether, you have some vascular disease, meaning plaque buildup, and whether you need to change your diet and exercise more and take some medications in order to get better. There is something about prevention surgery. For example, the main and big two things that we do in preventative care is stroke prevention and aneurysm rupture prevention. So when patients come in and they are found to have more than 80% carotid artery disease, then their risk of stroke in the next 3 to 5 years, we usually quote between 12 to 15%. This is not small. That means within any time within the given year, you have about 3 to 5% risk of stroke. When people talk about stroke, what is very difficult to deal with is that it is severely debilitating from your lack of ability to talk, lack of ability to see, or lack of ability to move from the sequelae or the consequences of the stroke. And it is not that you are just letting go. A lot of people think that once you have a stroke, you can just say, okay, I'm just going to pull the plug and let go. That is not usually possible. And you're just left with an incredibly devastating outcomes. If we see that you have that 15% stroke risk because you have more than 80% carotid artery disease, we're going to tell you, you probably should get this fixed before you have a stroke. Once that stroke sets in, you either get lucky and some of your tissues can recover, or you get unlucky and you can never recover, and some of the brain tissue matter that you have lost is permanent and you end up with permanent deficits. The second part of preventative surgery that we do is aneurysms. It's thought of as hereditary, meaning a lot of people say, well, my brother or my father had aneurysm, my uncle had some sort of aneurysm, so I want to come in and get checked. That's fantastic. And it is hereditary, so a lot of times we do catch these things in that manner. However, it is not all hereditary. A majority of the number is secondary to multifactorial or many different causes that include hypertension, hyperlipidemia, and smoking status. So some of these things can lead to aneurysm formation that is independent from your own body's genetics. And so when people come in and they get screened for an aneurysm and they're found to have an aneurysm, we actually continue to follow them, and there is a magic number when we say we should get it fixed. So that magic number is not the same in all cases. So most kind of the blanket magic number people understand is 5 centimeters for women and 5.5 centimeters for men. However, there are certain morphologies within an aneurysm where there could be some dissecting component. There's a lot of thrombus. It is irregular or saccular in nature, in which case then we worry that it has a much bigger potential for rupture. There are some people who also have that tearing or dissection pathology kind of in addition to the aneurysm, and the tears can have a outpouching called, penetrating aortic ulcer, which can then rupture as well. So if we see any of these things, then we would recommend that you get these things fixed before the rupture happens, which is a prevention. Only about half of the patients make it into the hospital once the aneurysm is ruptured. Once they make it into the emergency room, only half the people make it from the emergency room to the operating room. And if you're in that 50% of the 50% that make it to the operating room, only half will come out of it being alive. So these are some incredibly scary numbers. So prevention is key. And there is a surgery to help you prevent some of these devastating outcomes from happening. Now let's talk about the treatment side. So treatment side is when you come in saying there's something wrong with me. And a lot of times it's usually legs. So people come in with lower extremity pain or ulcers or wounds, and I have a whole different series as we had talked about on this. That is something that we can treat to make you better. So the treatment side is pretty simple in some ways because you come in, you know there's something wrong, you know there's something not quite right. And if this is due to circulation issues that can be fixed and the risks of fixing it is not that great so that you benefit a lot from it, then we're going to help you and we're going to recommend that you get a surgery or endovascular, meaning minimally invasive surgery with us in order to get the problem addressed. So in summary, vascular surgery encompasses both preventative side as well as the treatment side. And the preventative side can be just as scary, and it requires sometimes a pretty major surgical fix to prevent devastating outcomes from happening. So this is Dr. Inkyong Parrack with Sarasota Vascular Specialists. Let's talk about some more interesting vascular issues next time.